I'm Tom Leeper, L-E-E-P-E-R. I'm the Arizona Army National Guard State Surgeon. So today we are going to go to Chinle up on the Navajo Nation reservation and assess their medical operation at the Chinle Hospital. We're expecting increase in the number of cases. They've already had a spike, and there's a good possibility that this is going to occur again. So we want to make sure that we can identify areas of friction and pressure points so that we can help relieve them with proper planning and also identify staffing needs. I was up in Tuba City at Tuba City Regional Healthcare, and I did very similar operation there. That was actually worked out very favorably. We did a great assessment. We had another team of 14 medical professionals that were able to step in and take over where we left off. They confirmed our findings and are actually very helpful in providing extra staffing needs. So the PPE was identified as a critical need, and you know, to be perfectly honest, it's coming. It's very hard to come by down in the valley here, and even worse situation up on the Navajo Nation because they're so remote and their supply chain is so long. So they've told us that they need all that we can provide, and we actually have been kind of shaking the trees, asking for donations. Just whoever can provide a little bit, we're collecting it to get it up north. I think what people are missing is that this is coming to us in the valley. And so Chinle, Kayenta, Tuba City, they're indicators of what we should prepare for. So there's grave concern. They feel like they are lacking support. They definitely are having difficulty with enough PPE. When you start conserving PPE or rationing it, when you get to that level, that's critical. And in some cases, I've unfortunately seen some of the PPE actually getting reused. So this is probably the highest priority of need. What we need to do is look at the oncoming surge. And as they start ramping up the number of patients that come in, then we're going to have to meet that challenge with more providers. I've been in the military almost 40 years. I joined the Army National Guard because I want to be able to help our community in its time of need. I've never seen a need like this before. This is really the first state mobilization, total mobilization that I've participated in, even being in California Guard, Louisiana Guard, or the Arizona Guard. This is something new and historic. Donating PPE, if you're in any kind of occupation where you might have some spare PPE, then a donation would be great. That's really, in the short term, what's helping us stay afloat up on the Navajo Nation. Our supply lines are set to be reestablished up there so that we can get flow of PPE up there through the regular channels. But right now, we're resorting to making short trips with small amounts of PPE. So that's the first thing. The second thing is keep yourself safe and healthy. Take care of your families. If you have the opportunity to volunteer, there are ways to do that. Still using social distancing and keeping yourself safe. Explore those on the internet, talk to friends, but stay connected as much as you can. It's going to be important for our recovery.